Hey guys, in this video I'll teach you about the most important ophthalmic instruments and its uses. Now beginning with our first instrument, we have Chalazion clamp. It has a screw which is used for fixing the lid through tightening. It has serrations which is used for holding and grip. There is ring side which is applied towards the conjunctiva, as you can see in this picture. There is solid plate which is applied on the skin surface of the lid. Now speaking about the uses, it is used to fix the Chalazion for surgery and to achieve hemostasis. It is used for incision and curettage operation. It is used during intralesional injection of steroids in Chalazion after fixing it. There is one most frequently asked question whenever it comes to Chalazion clamp, and that is, what type of incision is given during Chalazion removal? And the answer is vertical incision, as you can see in this picture. Next instrument is two-way aspiration and irrigation cannula, and there is a reason why it is named so. As you can see in this picture, one end of is attached to a blunt needle through a silicone tube, and this end is fitted with the irrigation or infusion system. And the two-way cannula is itself fitted with a 2 ml or 5 ml syringe for aspiration. Therefore, it is called a two-way aspiration and irrigation cannula. And here are its uses. It is used for simultaneous irrigation and aspiration of cortical materials in case of extracapsular cataract extraction or extracapsular cataract extraction with posterior chamber intraocular lens. It is used to remove viscoelastic material after insertion of intraocular lens and can also be used to remove blood in the hyphema. Next we have Chalazion Scoop. It looks like a small cup which is attached to a handle. And here are its uses. It is used to scoop out the granulation tissue after giving incision on Chalazion. Also, complete scooping must be done to prevent recurrence. This is our Crescent knife. It has a blunt tip which is beveled off and is mounted on a plastic handle. And here are its uses. It is used to make a sclerocorneal tunnel in manual small incision cataract surgery or phacoemulsification. It is used for lamellar dissection of the cornea in the lamellar keratoplasty. It is further used for the sutureless trabeculectomy. It is also used to separate pterygium head from the underlying corneal lamella. Our next instrument is angular keratome. As you can see, both sides are sharp and therefore it has two cutting edges. And it has diamond-shaped sharp apex. Here are its uses. It is used to enter into the anterior chamber after making a sclerocorneal tunnel in manual small incision cataract surgery or phacoemulsification. It is also used to make corneal sections in phacoemulsification. Next we have BP handle or Bardparker handle. It has serrations which is used for holding and grip. And here are its uses. It is used for abexternocorneoscleral section for cataract surgery, skin incision in dacryocystorhinostomy, ptosis, or other lid surgeries. It is used to dissect the pterygium head from the cornea. It is also used to give incision in Chalazion operation, and it can also be used for suture removal after cataract operation or keratoplasty. Next we have MVR or V-lance blades. It has a fine straight triangular knife at the distal end having cutting edges on both sides. And here are its uses. It is used to make a side port entry at the limbus, also used in pars plana vitrectomy. Next we have Sinskey Hook. It is an angular fine hook which is attached to a long round solid handle. It is used to dial the polymethyl methacrylate non-foldable intraocular lens for the proper positioning in the capsular bag. It can also be used to manipulate the nucleus in phacoemulsification surgery. Our next instrument is wire speculum or universal wire speculum, universal eye speculum, guarded eye speculum. When it comes to its uses, all the three speculum have common use. That is, it is used to separate both eyelids for good exposure of the eyeball, mainly during extraocular operation, and is used for the common operations. Let's talk about each of them one by one. During sutural removal of conjunctival cyst or mass, removal of the corneal foreign body to give subconjunctival or subtenons injection, debridement and cautery of corneal ulcer, evisceration and enucleation, squint operation, pterygium excision. Let's talk about each of them one by one. Our next instrument is universal eye speculum. It has a spring, 2 limbs and a screw to adjust the limbs. It is called the universal eye speculum because it can be used on either side of the right or left eye. Its uses are: it is used to separate both eyelids for good exposure of the eyeball, mainly during extraocular operation. It can be used in the following operations: during sutural removal, removal of conjunctival cyst or mass, removal of the corneal foreign body to give subconjunctival or subtenons injection, debridement and cautery of corneal ulcer, evisceration and enucleation, squint operation, pterygium excision. Now when it comes to viva, you might be asked the following question regarding this instrument. That is, what are the disadvantages of universal eye speculum? The answer is, it has no guard, as you can see in this picture, and therefore eyelashes of upper lid may come in the field of operation. Also, it is not used in intraocular operation as it can cause vitreous loss by direct pressure on the globe. Our next instrument is guarded eye speculum, as you can see in this picture. It has a guard plate over here which keeps the eyelashes of the upper lid away from the field of operation. Therefore, 2 of these are required, one for the right eye and one for the left eye. And here are its uses. It is used for similar purpose as in case of other eye speculum. That is, it is used to separate both eyelids for good exposure of the eyeball, mainly during extraocular operation. And when it comes to guarded eye speculum, you might be asked the following questions. That is, what are the disadvantages of guarded eye speculum? And the answer is, since it is heavier, it provides more pressure on the globe. And also it decreases the operating field of vision. Our next instrument is wire speculum or universal wire speculum. It is a universal type and can be used in either eye. It's lightweight, hence provides little pressure to the eyeball, therefore can be used in both intraocular operation and extraocular operation. Its uses are similar to the previous speculums. That is, it is used to separate both eyelids for good exposure of the eyeball, mainly during extraocular operation. Our next instrument is plain forceps. It has serrations at the tip of the forceps. As the name says, it's a simple and plain instrument with an ability to perform the following functions. It is used to hold conjunctiva during any surgical procedure, to tie sutures, to hold skin during eyelid surgery, and to hold nasal scleral flap in trabeculectomy. Our next instrument is superior rectus holding forceps. It is S-shaped and has teeth at the tip. It has serrations which is used for holding and grip. Its uses are: it is used to hold conjunctiva to catch the superior rectus muscle belly for passing stage sutures or pedal sutures, as it helps to rotate the eyeball and fix downwards in cataract, glaucoma and other surgery. It is also used to catch the inferior rectus muscle as in keratoplasty. Next we have artery forceps. It has a serrations at the tip. It also has a catch. It may be straight or curved. Its uses are: to hold lid stitches and superior rectus stitch and then to fix the suture ends with a head towel, to cross lateral canthus in lateral canthotomy, to make irrigating cystitome from a 26 gauge needle, and to hold lacrimal sac prior to excision in dacryocystectomy, for hemostasis during dacryocystorhinostomy or dacryocystectomy. Our next instrument is iris forceps. It has a teeth at the tip, and its uses are: it is used to catch the iris for the purpose of iridectomy during operations of cataract, glaucoma and optical iridectomy. It is also used during excision for iris prolapse, tumors, and foreign body. Our next instrument is wire Vectis. It has a narrow limb. Narrow limb is attached to the handle. It has a wire loop at the tip and appears as a hollow spoon. Its uses are to remove subluxated or dislocated lens, to deliver nucleus in extracapsular cataract extraction with irrigating Vectis. Our next instrument is intraocular lens holding forceps. It has a blades at the tip. It is a spring action forceps with short, blunt and curved blade with smooth edges. Its uses are to hold optic of intraocular lens during implantation. Also, we have made an organized notes about the ophthalmic instruments and its uses, which you can download it below for free.